Welcome to SafeStart's Perinatal video series. I'm Iona Lewis, SafeStart Coordinator at Safe and Sound. This presentation is about supporting perinatal health. The focus of this presentation will be how cultural and social influences can impact perinatal wellness, knowing your body, and accessing support and resources. Social influences, challenges, and expectations. In general, the most prevalent societal expectation is that after giving birth, mothers feel positive feelings of joy, fulfillment, protectiveness, and instant love for the baby. This expectation leaves no room for the reality of postpartum challenges that affect many women. The reality is that a lot of women feel negative feelings, which may include lack of interest in the baby, exhaustion, disappointment, and being overwhelmed by the responsibility of motherhood or parenting. It makes perfect sense to have mixed feelings about having a child. This is a major life event. Allow yourself to feel the full range of emotions. Cultural influences, the challenges and expectations. Women of color often feel pressure to be strong and resilient in crisis. This pressure increases the likelihood that they will silence their own needs for support and, as a result, are more prone to developing depressive symptoms and not seeking appropriate treatment. Stigma around mental illness is prevalent in our cultures and social environments, but it is especially true when it comes to motherhood. Mothers of color often have perceived obligations to present strength, self-silence, and embody externalized self-judgment. Seeking the help of a professional and disclosing our symptoms is often seen as a sign of weakness, so much so that we will ignore the need to make our mental health a priority. Knowing your body, physical wellness. Every woman has the right to safe and respectful maternal health care. Perinatal physical and mental health issues impact women across cultural, racial, and economic lines, and those with the appearance of optimal health. Advocacy, whether it is the patient advocating for herself or women advocating for each other, is imperative in addressing issues related to maternal health and wellness. Knowing your body, acknowledging perinatal loss. When a baby is lost, multiple areas of grief can be felt. The baby, the future that was anticipated, the mothering, parenting that didn't happen. Losses can be symbolic, physical, or both. Perinatal loss is a complex combination of emotions, but people often don't acknowledge or recognize those feelings. Following perinatal loss, you might experience a range of emotions, including denial, guilt, anger, depression, envy, and/or yearning. Grieving has many layers, and it often takes time. During the grieving process, some emotions might pass quickly, while others linger. You might skip others completely. You might also experience setbacks, such as feelings of anger or guilt creeping back after you thought you had moved on. Certain situations, such as attending a baby shower or seeing a new baby, might be difficult to face. That's okay. Be honest with yourself. Excuse yourself from potentially painful situations until you're ready to handle them. If feelings of depression seem prolonged or you're having trouble completing your usual daily activities, consult with your physician, a mental health provider, grief counselor, or other social supports. Allow yourself to feel your feelings. Here are a few steps you may take to support your recovery following perinatal loss. Make your own decisions. Well-meaning friends or loved ones might suggest clearing out all reminders of your baby, but the decision is up to you. If you're not ready to pack things away, take as much time as you need. Create memories of your baby. You may wish to create a memorial in your baby's honor. Take it slow. Some days will be better than others. If you're overwhelmed thinking about the future, focus on getting through one day at a time. Take care of yourself. Rest. Eat a healthy diet and include physical activity in your daily routine. Talk with your partner. Don't expect your partner to cope with grief the same way you do. One of you might want to talk about the baby and express emotion, while the other might prefer to withdraw. Be open and honest with each other as you deal with your feelings. Keep a journal. Writing down your thoughts and feelings might be an effective outlet for your pain. Seek help from others. Friends and loved ones might not know what to say or how to help. Tell them when you need their support. If you want to talk about the baby, or if you'd like help keeping the baby's memory alive, let your friends and loved ones know how you feel. Join a support group. Sharing with others who've experienced pregnancy loss, either in person or online, can be comforting. Knowing your body, maternal mental health and wellness. If I tell you how I really feel. Women are often expected to work through depression and stress. Signs are often ignored as to not allow those symptoms to interfere with their work or caretaking responsibility. Internalized expectations of unwavering strength cause women to deny symptoms and forgo appropriate, effective mental health treatment and self-care. Fear of being under scrutiny, judgment, and being seen as unfit to care for your children are some reason many women do not reach out for help and support. Do not wait until life circumstances become unbearable. Seek support before it becomes a last resort. When experiencing bouts of crying, anger, sadness, sleeplessness, anxiety, and exhaustion, it can be difficult to know if what you are going through is just normal pregnancy changes in the body, or if you may be struggling with a perinatal-related mental health issue. Several factors influence a woman's risk of experiencing physical and mental health issues during the perinatal period, and the likelihood that she will seek and receive adequate treatment. Again, if feelings of depression seem prolonged or you're having trouble completing your usual daily activities, seek support. Our beliefs are often grounded in the values of culture and community. Our community holds the cultural values that determine how we cope and communicate our needs for support. Women also must grapple with the social and cultural perceptions of mental health that perpetuate stigmas. Some of the cultural and social factors that determine whether it is acceptable to acknowledge or discuss perinatal mental health issues are fear of stigma, fear of judgment, being perceived as crazy, fear of children being taken away, being undocumented, fear of deportation, economic status, fear of losing your job, lack of social support, loss of power in intimate relationships. These factors affect the range of symptoms and access to treatment options. Bringing forth opportunities to recognize and acknowledge these factors will hopefully encourage mothers to ask for help and ultimately achieve greater success in treatment. Accessing support and resources. Communicating needs. Every woman has the right to safe and respectful maternal health care. Having the ability to exercise choice and control immensely impacts the effects and recollections of birthing experiences. Our negative recollections of birth experiences are often a result of feeling an exertion of choice and control. There are things that you can do to communicate your needs for support and perinatal wellness. It is always okay to ask questions and advocate for yourself. Inform your provider if there is a language barrier. Prepare to have conversations with your provider about your physical and mental health concerns. Make a list if needed. Ask your provider about safe and confidential care options to address your mental health concerns. Maintain appointments and scheduled exams. Inform your provider if you have experienced pre-existing conditions such as hypertension, asthma, autoimmune disease, obesity, and or mental health concerns or diagnoses. Utilize all available advocacy and supportive services that may be available to you. How supports and interventions are delivered are important as well. Ask your medical and or social service provider about alternative perinatal support options. Doulas, healing circles, and other indigenous forms of healing that may meet your needs for support.